let's start with that. Tell us how many injuries you typically see, let's say in a week or a month, from either untrained motorcycle riders crashing or distracted drivers crashing. What does Chandler see on a typical month or week?
Well, we see about 250 traumas in a month, approximately, and of that, good majority of those patients involve motorcycle crashes, and motorcycle crashes is one of the top injury mechanisms that we see. And if you add in combination with different types of vehicles, trucks, then it's the number one cause of injury that we see in this hospital. And the impact is tremendous. You have a lot of resources that are involved to take care of these patients, from the activation of the trauma team in the hospital, the availability of the specialties, orthopedics, or the spine surgeons, or head injuries, neurosurgery, the operating room, and also the care involved afterwards, especially those with significant injuries that require them to be immobilized in bed, and long-term care in the ICU, and resources after that. So the impact is tremendous for motorcycle crashes with severe injuries.
Of the 250 traumas you typically see in a month, what percentage of that is related to the driver-rider piece of the equation versus some other kind of trauma?
Yeah, we don't. I don't have data for that.
Just approximately, is it half or 3/4 maybe?
What's the question?
I asked him, out of the 250 traumas you typically see in a month, how many are related to this particular problem?
We could drill that out, but we don't have the numbers readily available.
Okay, I'm just curious that the percentages, like if it's 50% or
we
less.
can tell you that blunt, which is our top injury, is about 97%, and that's our blunt injury is 97%.
That's pretty high. Yeah.
Yeah.
And so, what typically are the types of injuries that you see that result from crashes on our roadways?
Well, they come in all varieties. We average about one motorcycle death in this hospital per month. That's just this hospital. If you combine that with all the other trauma centers in the state, you probably have a very robust data in terms of how many deaths per month. And the type of patients we see here is similar to all the other level 1 trauma centers in the state, so you can almost extrapolate that. But the injuries could be as simple as just the extremity fracture, like an arm or a leg, but then it could get really severe with head injuries, which is very, very common, concussions, intracranial hemorrhages, skull fractures, and then followed by spinal cord injuries resulting from the crash.
Yeah.
And then from going down, you have pelvic injuries that makes a patient immobilized. They can't walk for 3 months, and they're bedridden. So there are a lot of severe injuries that can come with these motorcycle crashes, and they come in all different types of varieties, combinations of the things I just mentioned.
Mm-hmm. What is it like for your team when you see a victim come in, not just a fracture, but a pretty serious trauma injury? It must be hard for people, even though you're all trained. When you see it over and over again, it's got to impact you a little. I don't know if it affects you just seeing the carnage.
It does
happen. Yeah.
It does. I think that we are all trained to do this, and we've been doing this for a long time.
Right.
And we are passionate about what we do, but when you have injuries that really impact the patient, sometimes it gets a little hard and sad to talk about these patients, but we do it because we enjoy what we do. We're passionate about what we do and taking care of patients, and that's why we do it. and that helps us and focus on what we need to do.
Right. And how about the impact? Because what we want to do as part of this is share with other people that may be driving like this or may have experienced someone in their family going through, or a friend or whatever. How this impacts, it can impact a family long term, especially a really severe injury like you mentioned, spinal or otherwise. Because I'm sure you interface with that a little bit as part of your job here.
Right. You know, the impact, especially for these riders, all these riders are male, and a lot of times they are, the sole breadwinner in the family, and that impacts the economics, how to pay the bills, and how to bring food on the table, and all those things. So it does make a huge impact on these families.
Yeah, I want to make sure when we present this that, we present a perspective that you people see that most people don't see, The parties that are injured or impacted are part of that, but what you guys see is something that, is pretty unique and really defines the problem here that we're all trying to address, which is get yourself trained, get yourself safe, pay attention. Ain't it worth it,
Right. We don't just look at the disease itself. We look at the whole picture, because it's not just the patient that's affected. It affects the family, affects indirectly how we interact with them, and so it's a bigger problem than just treating a broken bone. So I think that's why we have injury prevention programs involved, as well as motorcycle safety classes. So those are all important.
Now the safety classes, who attends the safety classes? Are they offered just to the community at large, you're saying? Or talking about safety?
For those motorcycle riders.
Oh.
Yeah.
This is something that's required after the fact? No,
but I think our partnership with Chandler PD, when they put on those drills in the Chandler community, and our partnership with AMSEF, through those kinds of things, we're able to make a difference.
You bet. You play one of the most critical perspective roles, I think, in this whole understanding, because when it comes to your health and your spirit and your life, this is,
Yeah, I think
you need to be in control of you, but I don't think people stop and think sometimes that it could happen that easy,
Yeah, we see the big picture in terms of how it affects not just the patient itself, but the community as well, and the cost of community. And as part of level 1 trauma system, that's our obligation to help improve the livelihood of people in our community.
It's a big job.
Yeah.
For a big problem.
Yeah.
What other things would you like to say if you had a chance to just talk to John Q. public about what you've seen and what you know, and impart some piece of advice or worldly perspective?
Yeah.
What would it be?
Yeah. Well, I can understand that people ride motorcycles because of the lifestyle of the the joy regarding riding a motorcycle.
Right.
And which I totally understand. I think that when you do things, just like any activity we do, you have to take precautions, and as much as you can. Wearing a helmet is definitely the key. It saves you in a world of hurt. Because that piece of equipment definitely saves lives. I have seen that. Everybody has seen that. Patients come in with wearing a helmet after major crash. I've seen patients that are concussed, they're confused, but then after a day or so, they walk out of the hospital. Versus those without a helmet, they would not be in that situation. It's a big difference between a crash wearing a helmet and a crash without a helmet. And I think that if I would make one recommendation for those riding a motorcycle is wear a helmet. That'd be it.
I don't get why people don't do it. I can't imagine. I mean, I have a motorcycle too, and man, I look like a suit of armor when I go out.
It messes up your hair.
Yes, well, you know what? It's a lot better than messing up something else,
Yeah.
like the kinds of things you're talking about.
Right.
Not only helmets too, would you agree too when people are prepared when they're riding motorcycles and they have like the protective gear on their legs and their arms? We also
Correct.
that also helps.
I think protective is definitely key.
But you have to see some pretty major skin.
You know, I've seen
abrasions.
patients wear flip flops when they ride motorcycles.
Amazing.
And then shorts, shorts and flip flops, and they come in with it's like your skin just got peeled off of the asphalt, and those things hurt a lot, and it could have been prevented if you wore a closed-toe shoe, boot, padding, things like that. I think besides the helmet, the other equipment also are just as important, but I think if you were to pick and choose, helmet is number one, and then the other equipment involved.
Yeah. What else do you think? That was some of the main stuff I want to get from him. I can get some of the other detailed stuff we want to weave in from you, and then we just need to. We're trying to figure out a good backdrop for you for a photo, so it isn't a sterile conference room kind of thing, because they are pretty sterile.
Yeah.
Like where you've got a backdrop that, I don't want to say it speaks to trauma, but it might be the entrance to the OR or something that's got a clinical feel to it, but simple and close.
Trauma Bay
is open.
Trauma Bay.
Mm-hmm.
Yeah.
Maybe 1819.
Yeah.
Trauma Bay.
Yeah.
What is it? Just a special room where you take a patient into
Yeah.
for
Specifically for traumas.
trauma?
We can try that and see what you think, and then go from there.
Oh yeah, I'm sure I'll be good. You guys know where all the hot spots
let's do
are,
that.
but
Okay.
especially with all the white and stuff, it'll wash out the
Yeah.
photo in here. So
Yeah.
yes, we still have pieces to add, but I think what you said is just awesome. And
Short and sweet.
Yeah. I like
and when you see people that haven't worn a helmet, it just must hit you weird. Like, really, was it worth?
Well, I think too, like in our setting too,
don't
you
get
just
that.
see like a life